And in tonight's Health Watch, a new innovative procedure is helping people who suffer from knee osteoarthritis. Coral from the sea is being used in knee surgeries now. And health reporter Jenna DeAngelis got an exclusive look inside the operating room and spoke with some of the patients.
47-year-old Tanya Iacono has been an athlete her entire life. But her passion for competitive powerlifting began in 2019, taking her to nationals in June.
And I finished 4th in my weight and age class, so in the nation, so that's pretty cool.
But it was a tough journey to get there. While training, she experienced extreme discomfort in her knee, excessive swelling, and mixed advice from doctors.
So I was basically told by some to just not move, and for somebody that's really active, that can be really crushing.
Iacono was also told she would need a knee replacement, but then she learned of a new innovative procedure at the Hospital for Special Surgery.
Hearing that this was an option really truly felt like a miracle.
We spoke with her ahead of the procedure, which uses a tiny cartilage repair implant called CardiHeal Agili-C. It's made of a surprising material, coral from the sea.
Coral at baseline is over 90% identical to bone. It's the same chemical building blocks, it's almost the same structure. So it's already very similar, and then the body fully integrates that and makes it your own.
Orthopedic surgeons Dr. Andreas Gamal and Dr. Sabrina Strickland say it offers a less invasive option for patients who may not need or be ready for knee replacement.
There are some patients who have, for example, a very long skinny cartilage defect, which really hurts. And for that type of defect, we didn't really have any great options before.
If you are at a stage where everything is destroyed in your knee, essentially, a knee replacement is still by far the best option. This is really for the person with what we call early arthritis.
The doctors and patient invited us into the operating room to observe the procedure. First step is removing the damaged cartilage.
A loose piece of cartilage was floating around her knee.
The cartilage detached from her bone, which doctors explain leaves what they call a pothole, which can eventually lead to arthritis.
Cartilage, it just doesn't heal on its own, so this is a way to help the body heal and reform cartilage.
Next step, creating a hole in the bone to insert the small implants in a roughly half-hour procedure.
She's nowhere near ready to have a knee replacement, and so by putting these coral plugs in, it stimulates the body to grow over the coral cartilage, which hopefully gives her a knee that's going to last a whole lot longer.
And I'd imagine it's a little bit faster than a knee replacement recovery.
I mean, much less pain, a much smaller incision. I would say most patients at 6 weeks look pretty good.
These surgeons, who are also husband and wife, were part of the clinical trial which got CardiHeal FDA approval in 2022. And they follow their patients closely, like Heidi Jones, who had the surgery a year and a half ago.
Box jumping, I'm running, I'm squatting. I just did a 12,000-foot mountain. I'm just elated to have had it done and to be resuming everything I wanted to do on the other side.
Iacono can't wait to get back to the gym, but says her main motivation is her son.
I think any parent of a special needs child is always looking for ways to be indestructible because you have to be around for your kid as long as possible.
Jenna DeAngelis, CBS News, New York.
Technology is getting more and more impressive by the minute, isn't it?